Welcome back, beauties, to another episode of Holistic Beauty. I have another guest here. Her name is Myosha. Say hi.
Hi, everybody.
She's here with me, and we are going to continue this self-care series. If you watch last week's episode, you will see that we ended with talking about therapy as a form of self-care. And I just felt like we should kind of stop and settle right there and kind of talk about it. So I brought Myosha because she has some experience with therapies and different issues that people may be going with and helping them to become free of those things that may be kind of bogging them down, holding them back, debilitating them in life. And since we talked about in the last episode that therapy can kind of be taboo, I definitely thought, let's talk about this because I think it would be very beneficial to add therapy to your self-care. So if you are ready to hear more about it, come back and keep listening.
Oh, how beautiful, so beautiful, oh, how beautiful, oh, how beautiful, oh, how beautiful, oh, how beautiful, you wanna be beautiful.
Okay, so we are going to get right into this. Therapy as a form of self-care. It's something not most people would think about adding to their self-care regimen. You think about pedicures,
Yes.
you think about massages and all of these other luxuries. But what I want to get across to you is to care for your whole person. Not just care for your external, because we are more than just a face and we are more than just a body. We need to take care of ourselves mentally, internally, all of that. Besides diet and exercise, there's much more to us. So we recommended therapy as a form of self-care. Myosha, let's chat about this. So number one, what do you think about therapy being part of self-care?
I think it's absolutely necessary. It's kind of hard to say I need to go to therapy. You know, it's kind of sometimes a harsh reality to face. And then sometimes it's not that harsh. And you're just like, I just need to kind of process through my thoughts. I need to kind of talk about what's going on with me. So I think it's excellent for self-care. Like you said, we do all of the external things,
Right.
and then internally we're having a breakdown.
Internally,
we're throwing dishes at the wall. We're cussing people out. Internally, all
Right.
this is going on,
Yes.
and externally we're like, oh,
Smiling.
I'm great. It's wonderful.
Right.
You know, and it's not really wonderful. We really need to kind of think about how we're feeling. So I
That's
think it's definitely necessary.
So true. I laugh at that because you kind of don't think about it, but like I chopped your head off in my head.
Yes.
Like,
Yes.
like I told you,
Definitely.
okay, face to face, and I was like, okay, yeah, it's cool.
Yeah.
I'm cool, but I am so chopping your head off, like internally in my brain.
Yes.
No bueno. Not good.
Definitely.
Not good at all.
Yes.
So why do you think people ignore the fact that they may need therapy, or they're afraid to go to therapy, or it is taboo, like something that just isn't talked about? Why do you think people...
Because I think over the years, therapy has just gotten a bad rap. We think that it's only for people that are crazy. You know, we
Right.
think about therapy, we think about psychiatric wards, we think about straitjackets and padded walls. We think about all of those things that society, the movies have kind of made it out to be. So we kind of stray away from it because we don't want to feel like we're crazy.
Right. Don't want to feel like something's wrong with us. Don't want other people
Yes.
to think something is wrong with us. Like, oh, why is she going to therapy? Is she not mature enough
Yes.
to handle her life, her situation?
Yes.
I had someone make a statement that says, well, I just put my big boy or big girl pants on and just, do what I need to do. As to say that if you reach out for help,
Yeah.
or if you need some kind of assistance or some type of support, you don't have your big girl, pants
Yes.
on, or your big boy pants on. You're just not mature enough, or just not capable of handling your life, and you need to get it together. I found that offensive. But I found that offensive. But so let's talk about what type of therapies are there, because I know some people may be hearing this and they're like, well, what kind of therapy would I include for self-care?
Well, let's think about it like this. If you break your toe, you're gonna go to the doctor that specializes in dealing with, something to do with your feet, or with your hand, or your head, or your heart, if you have things going on with your physical body. So mentally, when you think about different issues and things that you would have going on, there are different ways to address it. You have your basic therapist, which some may call them a LPC, licensed professional counselor, or a clinical social worker. Those are pretty much kind of equivalent, where they just kind of help you process through your thoughts and your feelings and what's going on. They use different techniques to do that. And then you have those who are considered psychiatrists or clinicians, those who can prescribe medication. If you're going through something that, like you said, that's debilitating, you need just a little extra push outside of talking, you may need some medications to kind of help calm your anxieties or whatever is going on with you. And then you have those that are specialized in the Christian field, so you have Christian counseling, inner healing, and those types of things, because I know sometimes as believers it's hard to kind of look at the secular forms of helping and processing. You may want to involve scripture or prayer or lessons having to do with coming from biblical studies and things like that. So you kind of have a variety of different avenues that you can go. Some pastors do counseling and things like that. So you have couple of different options that you can kind of lean on as it concerns counseling.
Okay. So do you have to have something terribly wrong with you, or something like super obvious, like I can't even get out of the bed, or like I'm not eating, I feel so depressed, to go to therapy or to implement therapy as part of your self-care routine?
Absolutely not. Absolutely not. It doesn't have to be anything terribly wrong. It could just be, I just had major transitions in my life. Like myself, for instance, when I got married, right after I got married, I had a baby.
Yes.
I should say I got pregnant before I had the baby within a couple of months, and it was just a lot of life changes. And I wasn't depressed about it. It wasn't hard for me to get out of the bed. It was just life. And so for me personally, I said, well, let me kind of talk through this. And so I lean more towards pastoral counseling. And it's just like, let's unpack. And one thing that my pastor says is like, well, right now you have everything in one room. Let's put everything in its proper place.
Oh, wow.
And so for me, self-care, when a lot of changes are happening, it's kind of like I pack everything into one area and I'm trying to sort through it on my own. And it just kind of brings somebody else into my world from the outside looking in that can say, well, this goes over here and this goes over here. Well, let's deal with this right now. It's pressing. We can kind of shelve this for some time. And so it just kind of helped me just kind of process through, take some deep breaths, and like, okay, I got it. We can handle it. Makes sense. It's a little clearer, and then I just keep moving with life. So it wasn't anything that was severe that pushed me to talk with someone about it. So it doesn't have to be. No, it doesn't have to be.
I love that. Didn't you guys love that analogy? Like, it helped me. I was sitting here trying to keep composed, but I wanted to say yes. That was such a great analogy for me. And as you were talking, I was like, okay, yeah, that's what I do. And it reminds me of, you know, when your house is all cluttered and a mess and you hire a professional organizer to come in and help you find a good place to place everything, so everything doesn't feel so overwhelming and look a mess and be all cluttered. So this therapy is our professional organizer. Our professional organizer to help us put things in their place. That is so good. Like, if you're here with a tablet, write that down because that was so good. I believe that'll help a lot of you. And I think that it's so important that you said not to try to always handle it on your own, and have somebody else thinking with more of a clear mind.
Yes.
I know for me, it's like literal environments. Like if my room is a mess, and so is my mind.
Yeah.
Like I can't think straight.
Yes.
I feel like very overwhelmed, and there's not like a peace and clarity like in my thoughts until I clean that space, until I clean that area and put everything where it's supposed to go. And this is coming to my mind. You know, sometimes you can fake clean.
Yes.
Where like you throw it
Instead
under
of
the bed.
stuff
You stuff it somewhere. Like I'm gonna
Yes.
stick all those shoes
Yes.
like under the bed, or I'm gonna stuff all of this stuff in the drawer or in the cabinet, but I can't open that cabinet because if I open that cabinet, everything's gonna come falling out. So it looks like the area is clean. It looks like the area is put together, but really it's not. You just found a place to stuff it all. And so I think that's important, and I believe that a lot of people probably do that. I know, like, I'm guilty.
Me too.
I'm guilty
Definitely.
of doing that, like, in a natural,
Yes.
for real, and, like, internally, like, I do that. But I'm finding it comes back to haunt me.
It definitely comes back. I remember when I was in college, we had a leadership conference, and there was Susan Taylor came.
Okay.
I believe she was the editor-in-chief of Ebony magazine, if I'm correct. I'm not sure. It's Ebony or Essence, one of those magazines. But one thing she said that stuck with me was, and I'm paraphrasing, it was something to the effect of, if I'm not well, I can't help you. And so I really took that to heart, and that's how I saw it. I was like, I have to be well to be my most effective self in every area, as a parent, as a wife, as a minister, as a leader, in whatever capacity I'm operating in life. I can't help you, or I can't be effective if I'm not well. And so I took that, like, mentally, I need to deal with stuff. I have to deal with it. We don't want to deal with it. Sometimes it hurts to deal with it. We don't want to talk about it, but it's bleeding out in a lot of the areas of our life, how we treat our spouse, how we treat our kids, how we treat our coworkers, and we don't realize that it's coming from unprocessed stuff, things and feelings and all of those things that we never, like you said, we just stuffed it away. We made it look pretty, but really it's not pretty at all.
Y'all, so good. So good. That is so good. And that in a nutshell is my whole reason for like doing this self-care series, because if you aren't well, you can't go out there and be your best self, whether it's trying to run a business, whether it is being a parent, like she said, being a wife, or just being a happy, fulfilled individual. You know, in this life, doing the things that you feel that you are here to do in this life. You can't do it when you're not well. And well is not just, you know, your diet and exercise. Mentally well can shut you down just as quick. Just as quick as a physical illness can. And so I want you all to really, really think about this, really take this in and process it, and start thinking about, what things have I stuffed away? What needs to be processed? What needs to be put in its right place for me to function in this life efficiently and effectively? Because we don't want to just be here. We want to be effective. We want to be effective, you know, in this life. You don't want to walk into a clean room that looks clean, but you're like, what's that smell? What's that smell? Because we kind of put dirty dishes, you know, away under the bed that nobody can see. But the stench is there. The stench is there, and it will permeate into all areas of your life. And you may not be aware of it and struggling like, why isn't this working out? Why can't I make this work out? Why does it seem I keep having issues with this and that? And so we may not really be aware of specific issues that we have. And that's why I believe going to therapy, making it part of your self-care routine so you can get that professional organizer
Yes.
to come in and help you unpack things that you may have even forgotten that you pushed far, far under the bed.
Yes.
And you're like, I don't even remember pushing
Yes.
that under there. I don't even remember how that got under there. I don't even remember why I put it under there.
Yep.
But having that professional organizer, having that therapist to help you dig through the dirt, dig through
Yes.
the muck, and reorganize your state of mind and help you reorganize your life, it is crucial to being your most authentic
Yes.
and best self.
Yes.
What else do you have to? I'm like, this is so good. I just want her to say more and more. And she did have more to say. So meet me back here next Friday as we continue our discussion about making therapy part of your self-care. Thanks for watching.
Oh, how beautiful. Oh, how beautiful.